name is Dr. Alan Savage.
What is your profession
I am an orthodontist.
and what do they do?
Orthodontists focus on aligning teeth and jaws, and also we are able to modify growth in patients.
Where do they work?
Orthodontists can work in private practice or they can work in a corporate setting such as this one.
Is there any uniform worn, and if so, what is it?
Well, normally you see a combination of things. You see some orthodontists will wear scrubs, as I'm wearing now. You also will see some that will wear a shirt and tie to work. It just all depends on the provider.
What is the work schedule like?
Most orthodontists will tend to work between 4 and 5 days a week. Majority of it is with patient care, but there is some administrative work that has to be done along with it. We spend a lot of time behind the scenes doing things such as treatment planning that a lot of patients do not see. So, but that's mainly about 4 or 5 days a week.
Okay. Describe a day in the life of an orthodontist.
Well, first thing in the morning to get here and run through the daily schedule to see which patients are scheduled and for what procedures. Occasionally we will have a office meeting that we have to discuss any patients in particular that may require special attention. After the schedule is checked, we seat our first patients, and we keep very good records on the patients so we can check the chart to see what the patient is coming in for that day. And usually the assistants help me out with a lot of things. In orthodontics, I see a high volume of patients as most orthodontists will do in a day. So you rely very heavily on your assistants to help with the adjustments and things.
Okay. What education is required?
Well, to become an orthodontist, you have to do 4 years of college, followed by 4 years of dental school. After the 4 years of dental school, hopefully you would have done well in dental school because it's a pretty competitive specialty, as most dental specialties are. After your 4 years of dental school, you would do anywhere between 2 to 3 years afterwards. So it's a total of about 11 years. I actually did one residency in between dental school and orthodontics too. So about
Are
11
there
years.
any tests required?
Yes, there's quite a few tests. So of course you have your exams, with your classes in college and everything, and then after college, you go to dental school, and of course with every class that you take, there will be some type of exam. But as far as standardized tests, there's when I went through school, it was 2 national exams. There was a national exam after the first year that basically tests you on all the basic sciences that you've learned, and then after that, there was one I took my senior year, and the senior year exam focused more so on the application of what you learned, and applying your dental knowledge.
What is the pathway of training?
The pathway, as far as, what do you mean by
Like
that?
internships?
Oh, okay. Well, we have more so residency programs that, there's different types we don't have internships, but we have different types of residencies. The first residency that I did was in general practice. The way that works is you typically kind of rotate through different departments. Say in a hospital, for example, you actually will spend time in the ER, you'll spend time with the ENT doctors, and you also, depending on that, you can decide, you also rotate through different dental clinics, which is nice because you can be exposed to every type of dental specialty. Okay, so the residency I did had a little bit of everything. We had some dental specialists that worked with us. We were able to rotate through some of their clinics and also become exposed to some of the medical specialties as well. So and that was just with general practice, but of course I focused more on orthodontics in the second residency. That was my specialty. But you can choose which direction you want to go, which is nice.
Is a license or certification required?
That's a good question. Yeah, there is a license and certification required. Every dentist that's practicing is supposed to be licensed through your state. Now, the way that works is there's certain regions of the country that require certain types of exams. Now, there's a clinical portion of these exams and a written portion. So, to answer your question you asked me before, there are exams, there's written exams that you have to pass to get out of dental school. But even after you get out of dental school, you're still not licensed to practice, and you have to pass a state, licensure and board exam. And some of them have different criteria. Some have, they all have a clinical portion, but there's others that have written portions that you have to pass as well. And then you, of course, will apply for a license in whatever state once you pass the written and clinical exam.
What skills are needed?
Well, to be a good dentist, I think number one is, one thing I underestimated was that you have to be not only good with your hands, but you have to be good at talking to people. Dentistry is a profession that a lot of people are nervous. No matter what type of dentistry you're doing, you have to be able to communicate well with people. You have to be able to relax people. A lot of times when they come in, they're nervous. They don't know what to expect. So you have to be very good, have good people skills. Another thing that is challenging with dentistry is that you're working in a very small area. You have to have be very good with your hands, but also have a scientific mind, be able to analyze things and good at problem solving, and have an artistic side where you can visualize the final outcome of whatever you're trying to create before you start. So those are the biggest things.
Do you approve of the salary while or not?
Do I approve of the salary?
Yeah.
Yeah, the salary I approve of. One of the nice things about the profession is you're able to, most dentists are able to make a decent living. It's one of the better paying professions that are out there. Yeah, so it's not bad.
What do you love about your profession?
What I love about it is I get to work with a range of ages, but particularly young adolescent patients, and I feel that I get to build a relationship with my patients because I get to see them over 2-3 year period for the most part, and I get to see them go through a lot of changes, usually for the better, and definitely for the better as far as their smile is concerned. And a lot of patients come in and they're nervous, they're shy, or they're unhappy with their smile and they're too shy to smile, or they're usually more reserved at times than people who are more confident, that have a nice smile to begin with. And a lot of times it's interesting, you see that patients their confidence will build as their teeth begin to straighten, and they're happier smiling, and they don't cover their mouth or smile with their lips closed anymore. So it's very nice to develop relationships with people and to help them feel better about themselves and build confidence.
If you could change anything about your job, what would it be?
If I could change anything about my job, there's not a whole lot that I would change. And the reason why I said it, with any job, any profession, there's going to be challenges with that profession. Some of the things that I like about the job also would make it challenging. Of course, anytime you deal with, you work with the public, you're going to have, a combination of different personalities that you come in contact with, and sometimes that can be good, and sometimes that can be not so good. But you just do the best you can, and to work with everyone and to make everyone happy.
Why is this health career field important?
It's important because, as I mentioned earlier, the teeth are part of the body, and not only do we straighten teeth, but we also educate patients on the importance of taking care of their teeth and themselves, and we like to let patients know that the way you take care of your teeth also affects your overall health, which is very important. And we try to educate patients. Sometimes they may never been told the importance of taking care of their teeth, and so it's very important even from that standpoint. Not only when we talk about building confidence, but also we help patients with their function and being able to properly chew their food, being able to even to speak properly. We're working on their tongue posture. So we do a lot of things I feel that are important.
What does this career contribute to the health field and community at large?
Well, it contributes to the health field, of course, as I was mentioning just a second ago about the teeth are part of the body, and systemically, they've dentistry. Well, the oral health in general has been linked to things like cardiovascular disease, diabetes. It's important that we get the message out to patients about taking good care of their teeth because it can affect their overall health. So what was the second part of that question? You said it's important to the community and what else?
To the community at large.
The community at large, yeah. Just patient education and knowing, the importance of taking care of the teeth. That's the main thing.
Okay.
Yeah.
Thank you.
You're welcome.